Hi, I am Mohamed Amjad Al Awada, KIB 190706 from Group 11. Prostate cancer is the development of cancer in the prostate, a gland in the male reproductive system. Most prostate cancer are slow growing, however, some grow relatively quickly. The cancer cells may spread from the prostate to other areas of the body, particularly the bones and lymph nodes. It may initially cause no symptoms. In later stages, it can lead to difficulty urinating, blood in the urine, or pain in the pelvis, back, or when urinating. A disease known as being prostatic hyperplasia may produce similar symptoms. Other late symptoms may include feeling tired due to low levels of red blood cells.
Okay, today we are going to be talking about prostate cancer and the limitations of current treatment. So as my group mentioned, we have already talked about what is the prostate for, but I'll just say it again. So what is the prostate for? The prostate is actually a small walnut-shaped gland that produces seminal fluid, and this seminal fluid is what nourishes and is used during the transport of the sperm in the event of ejaculation for fertilization. So, prostate cancer is like any other cancer, which is there is suddenly a mutation of the cell and there's uncontrolled cell division. Okay, so prostate cancer is nothing different. It's also the same, but it's just in the prostate. Okay, so prostate cancer is actually a very common cancer, and it's one of the most common in men. Okay, so we're going to be talking about the limitations of current treatment. So the first real major limitation is that early detection is very important. That means we need to know, as the doctor needs to know as fast as possible. And that means that you have to get regular screening, and many people don't do that because they don't encounter symptoms. So it's actually a lot of people actually don't get any symptoms until it progresses to a late stage of the cancer. So that's what's happening nowadays also. So what's happening is they wait and until there's a serious symptom, then only they're like, oh no, we need to do something about it. And that's a very big limitation because we don't really have very good ways to solve late stage prostate cancer, and a lot of them will progress that way because there's no symptoms or very minor symptoms. Okay, the next thing we're going to be talking about is the current treatments and what are their problems. So the first very common treatment is surgery, and the complete or partial removal of the prostate. Okay, so it's like the typical cancer. If it's a breast cancer, you remove the breast, and so on. Testicular cancer, you remove the testes, and in this case, prostate cancer, you remove the prostate. So nothing very too special there. Okay, so in prostate cancer, the surgery is called what is it called? It's called laparoscopic cancer, and there's a few names for it depending on where you enter and remove the cancer from, whether it's between like your anus and your scrotum, or it's above from the tummy region. Where are you entering to remove the prostate? And there are different risks involved, but they generally have the same risk throughout. So they're all major surgeries. So major surgeries have their typical dangers. Major surgeries might have reaction to anesthesia, like allergic reaction, bleeding, clotting in legs and lungs, damage to nearby organs, infection. These are very common surgery problems. Then we also have problems like urinary continence, which means you cannot control your urine. Like when you gotta go, there's no like wait time. Okay, and this one is the next problem is very common across all, just like the urine one, which is erectile dysfunction, which means the male can no longer get an erection. Okay, and also the loss of fertility. So that's a very common problem. Okay, so we also have the same problems with radiotherapy. So radiotherapy is using radiation to kill the cancer cells, either focusing a beam or putting some radioactive isotope near there. They're called seeds. You put it there and it just kills the cancer cells slowly. But there are also the same problems, which is urinary problems, erection problems, and most importantly, bowel problems is a new one compared to just now. Bowel problems like difficulty going to the toilet and things like that. The next therapy, very interesting. It's actually called cryotherapy. I wonder why. But cryotherapy is you freeze the prostate and you freeze them using low temperature and you kill the cancer cell. So they also have their own side effects. There's swelling in the penis and scrotum, pain and burning sensation of bowel and bladder, freeze damage. So most likely, like even more likely than when we look at the first one about the surgery, to have erectile dysfunction. So no erection. And same urinary incontinence, which is like when you gotta go, sort of thing. You cannot control your pee, which is very embarrassing for a lot of older men. And also there's a slight chance for fistula, which is the rectum connecting with bladder due to the freezing.
Now, moving on. Let's talk about hormone therapy. We all heard about hormone therapy, such as cases before, like for people to change their gender, they also use hormone therapy. Well, fun fact, hormone therapy is also used to help treat prostate cancer. Well, how does it work? Well, basically, hormone therapy is a nice way of saying you're being castrated or you're being an eunuch. Whatever it is how you want to understand it. But yeah, and hormone therapy or castration, as we all know castration. We all imagine it to be like a physical method of cutting it, but no, it can also be involved with use medically, like using drugs. So what actually happens is that the hormone therapy helps decrease the androgen hormone in the patient, which also at the same time leads to decrease in sexual desire, erectile dysfunction, and even the shrinkage of the penis and testes. It could even lead to osteoporosis, which is the bone thinning, thus making you break your bones more easily, and even anemia. Now, moving on, let's talk about chemotherapy. I think throughout our life we heard chemotherapy, especially for cancer patients, all the time. But I don't think most of us really understand what chemotherapy really is. And even if we do, I'll just make you remember it again. So chemotherapy is basically we're using drugs to attack fast dividing cells, which is basically the cancer cells, the fast dividing cells. But at the same time, cancer cells are not the only cells which are actively dividing really fast. There are other important fast dividing cells too, like the bone marrow where our blood is produced, and also our hair. That's why we see cancer patients has a lot of hair and they look very anemic at the same time. It's because they are also attacking all those important fast dividing cells beside the cancer cells. So it's very typical chemotherapy symptoms that we are able to observe, such as fatigue, hair loss. They are easily bruised and easily bleed, easily affected, anemic. They're nauseous and vomit easily. Their appetite usually changes, constipation, diarrhea, and they feel the sore around their mouth and throat problems. They could even lead to nerve problems like peripheral neuropathy, um, which could lead to numbness. And we can also see cancer patients that undergo chemotherapy have really dry skin because our skin is also an actively dividing cells, obviously, and weight changes because of the change in appetite, and even chemo brain, which basically affects your concentration and focus. And it leads to fertility problems, which also leads to libido and sexual functional problems. Now, next I'll be talking about immunotherapy. So, immunotherapy, it obviously involves your immune system. So, what immunotherapy basically does is that it stimulates your body's immune system to find and attack the cancer cells. So it's like a vaccine actually, but not really. I'll further explain it. So basically, there are several approaches used in immunotherapy, and most of these are now in clinical trials, and has not yet been approved in routine use. But the FDA has approved one type of immunotherapy at the current moment, which is Provenge. It has been shown to help slow cancer growth in men with advanced prostate cancer. And for this treatment, the medical team basically must remove the immature immune cells from the man with advanced prostate cancer, and then the cells are then re-engineered to recognize and attack the prostate cancer cells, and then put back into the body to attack it. But there are several risks obviously involved. For examples, like the clinical trials have not clearly shown successful results so far, and there are several minor side effects for the immunotherapy. Okay, now moving on to the final one is focal therapy, which is basically we using a needle thin probe to circle the tumor with a special solution that kills the tumor by freezing it. It's almost like cryotherapy, but not really. This one we use a needle and we don't target the whole gland. We just focus on the tumor itself. So ideally, in an ideal situation, the focal therapy would lead to fewer side effects, including changes in the urinary function. Um, but focal therapy is kind of a new therapy, and the long-term benefits of local therapy are not yet known. And research is still being done to study this further. However, the FDA has approved of this method to destroy the prostate tissue, actually, but not clearly to treat prostate cancer, because many of these treatments are new, so insurance coverage is not readily available, so there's a risk because a lot of insurance company doesn't cover this treatment, so you're actually taking a risk when needing this treatment. Okay, that's all. Thank you very much.
Hello, my name is Abdullah Ibrahim Ahmed Abed. My metric number is KIB190705. The device that I'm going to talk about helps detect the metastatic on prostate cancer. This device forces samples through tiny channels less than 10 microns wide. When prostate cancer cells are forced into these channels, metastatic cells exhibit something called as blebbing, in which portions of these cells' outer layer bulges outwards from the more inner rigid layer. This also shows that the highly metastatic prostate cancer cells, are more likely to exhibit blebbing than normal and less than normal cells. This device also can quickly detect the amount of blebbing in cells from cancerous samples.
Hello, my name is Omar Ahmed Jabir Sayed, metric number KIB190704 from group 11. I'm going to complete what my group have already started about prostate cancer, and I'm going to start with the symptoms of prostate cancer. Symptoms of prostate cancer may include, as shown in the picture and shown in our report, bone pain, as well as pain in the lower back or hip, and severe pain in the pelvic section. Also, more frequent urination through the day and night, as well as urination troubles such as burning or poor flow of urine. Also, patients with prostate cancer usually face this problem called hematuria, which is the presence of blood in the urine, as well as difficulty in the urination with ejaculation, as well as losing weight and appetite absence. Risk factors of prostate cancer include the age. Mainly, researchers say that men under the age of 40 years old are rarely to develop prostate cancer. So, like, mainly It's observed in men. Prostate cancer is observed in men who are older than the age of 40 years. Also, the history of family is a big risk factor, since research proves that a man is generally 2 to 3 times more likely to develop prostate cancer if his father or brother or son has the prostate cancer or had it before. So the risk of developing the prostate cancer increases with the number of family individuals diagnosed with prostate cancer. Also, as well, smoking is also associated with a great risk of death from prostate cancer, since studies show that the risk of diagnosed prostate cancer could double for men who are heavy smokers. Also, some other research say that the diet play an important role as a risk factor for prostate cancer. The grading of prostate cancer. Here I'm going to talk about the most familiar grading system, which is called the Gleason grading system or Gleason pattern. This grading system provides on a scale from 3 to 5 grades from 3 to 5 to each given tissue portion examined. In the past, the scale used to be from 1 to 5 as shown in this picture, but recently they use it from 3 to 5. If it's below 3, so, it suggests a rank of below 3 suggests that the tissue is almost normal. At a rank almost equal to 3 indicates a slow growing tumor. At a grade high of 5 suggests a highly active or aggressive high risk form of prostate cancer. The Gleason method then produces a score by combining the two most frequent grades identified. The Gleason method, it helps the doctor determine whether the tumor is low, intermediate, or high risk cancer. Here, the treatment of prostate cancer. It's divided into three main categories: surveillance, localized therapy, and systemic therapy. For the surveillance, there is active surveillance, which tracks cancer development with routine PSA tests, DREs, and regular biopsy examinations. Then the watchful waiting is less involved cancer monitoring system without treatment. It does not require routine biopsies or other intensive monitoring devices. The second category, localized therapy, divides into surgery, radiation therapy, and focal therapy. The surgery, the main one is robotic-assisted laparoscopic radical prostatectomy, the RILP, and is the most common type of prostate cancer surgery done lately. Then comes the radiation therapy, which uses high energy rays to kill or slow the growth of cancer cells. Then the cryotherapy, which freezes the prostate gland to control or destroy the cancer cell. Then the focal therapy, which kills small tumors inside the prostate without destroying the whole gland or any healthy tissue nearby it. Then the systemic therapy, which includes the hormonal therapy, chemotherapy, and immune therapy. The hormonal therapy basically uses drugs to block or lower testosterone and other male-sex hormones that fuel cancer. Chemotherapy uses drugs to destroy cancer cells anywhere in the body. It's usually used with most of the types of cancer, not only prostate cancer. And it is used for advanced stages of prostate cancer. Then comes the immune therapy, which stimulates your body's immune system to find and attack the cancer cells. That was my part, and thank you so much for watching.
This is how a regular prostate looks like and the infected prostate with cancer looks like. This is the regular prostate. As we can see, it doesn't have the bubbles or semi-bubbles as we can see, but the infected one got these bubbles. So this is the difference between the infected and the uninfected prostate. Prostate cancer is the most diagnosed cancer in men, and only lung cancer kills more men. Sadly, prostate cancer is also an indolent condition that in the majority of people living with prostate cancer rarely causes symptoms. Autopsy tests have shown that over half of people in the age group typically considered for screening have a asu- asymptoma- asymptomatic cancer in their prostate glands. Any test that causes the prostate biopsy would reveal cancer in a high proportion of men. There was even there was not even a trend towards a reduction in prostate cancer specific mortality in the screening group compared to the usual group to the usual care group after a median follow-up in the more than 13 years. PSA screening was conducted every 4 years at most facilities, and the PSA above 3.0 Ng/ml was considered an indicator for prostate biopsy. There was a substantial decrease in prostate cancer specific mortality in screening community relative to the normal treatment group after an 11 years median follow-up. The main question with the study is that people in the screening community diagnosed with the prostate cancer may have received better quality and intensive and more intensive treatment than people in the normal care group who have prostate cancer. So as we can see, we have covered these 2 points. Now we are going to the third point, which is our last point in the conclusion of the prostate cancer. False question with the study is that people in the screening community diagnosed with the prostate cancer may have received better quality and intensive and more intensive treatment than people in the normal care group who have prostate cancer. So as we can see, we have covered these 2 points. Now we are going to the third point, which is our last point in the conclusion of the prostate cancer. False positive screening test are normal, and concern about prostate cancer have been shown to rise in about 20% of men for at least a year. A prostate biopsy is often associated with discomfort, hemorrhage, complications, and infections with the need for hospitalization. In 1 or 2 of every 200 people who undergo a biopsy, up to half to prostate cancer diagnosed with a screen would not be causing the person lifetime symptoms.